Welcome to HPP 690E. This is Aging in the U.S. Public Healthcare Programs. This is your Week 1 video. In Week 1, we look at one of the biggest programs for the aging populations in the United States, Medicare. If you don't have any experience in your other courses yet with Medicare, we're going to do a brief overview of what is Medicare, and we're going to compare it to other things this week and next, such as Social Security and Medicaid and private insurance. So what is Medicare? Well, in 1935, part of the New Deal, they passed Social Security, which was a basic income for people of retirement age when they no longer worked. And this was because a lot of people didn't have enough savings to retire. There was a lot of discussions about adding in a healthcare component in 1935 to Social Security, but it didn't make it through. However, that conversation was revisited multiple times, and Medicare was finally passed 30 years later in 1965. And much like Social Security, this was to provide kind of a safety net for those who are over 65 and give them health insurance. The reason why this was important was because folks who stopped working usually had a really difficult time finding health insurance, since it was often offered through your employment, through your employer. So once you retired, it was really difficult to obtain any health insurance. Medicare was really intentioned to be, but is not really at this point, universal. It's really tied to Social Security norms in that most everybody gets Social Security, but there are some folks that do not get Social Security. An interesting evolution of Medicare was it also later included people with certain disabilities or diseases. A little more history. Medicare took effect in 1966, the year after that it became law. 19 million people signed up for Medicare when it began. So that tells you how big of a program that was in 1966. A lot of tweaks have been made to Medicare, and almost every year Congress does some small tweak to Medicare. These are a couple of the big ones. 1972, Medicare included long-term disabilities in individuals with end-stage renal disease. So that was folks who couldn't work but weren't 65, disabled. They could qualify for Medicare. Hospice was added in the 1980s, so all those hospice services. ALS was most recently added in the early 2000s. One of the things you'll see this week is Obamacare, or the Patient Protection Affordable Care Act, made multiple tweaks to Medicare to try to create some efficiencies. And at this point, there's about 60 million people enrolled in Medicare. So from 1966, we started with 19 million people signing up to about 60 million people enrolled today. So what does Medicare look like today? Well, there's 4 major parts. Part A pays for hospital stays, those acute costs. Part B is for doctors and preventative, so not in the hospital, when you're going to your physician out in the community. Part C are Advantage plans, and you'll learn more about them this week. But Advantage plans are basically plans that are administered by the federal government, by Medicare, but all the work is done by a private company. A lot of people choose to do a Medicare Part C Advantage plan because sometimes they offer different things that consumers want. And then Part D, you will also learn more about this week, covers prescriptions. You're going to see some terms this week in your readings and in the other videos, so let's just do a quick review of the terms. Medicare, as you know, is the federal government health insurance for people 65 and older. There are some specific groups of folks under 65 that Medicare covers. Medicaid, which we will talk about more later, is state government health insurance for those unable to afford health insurance. Dual eligibles, and you might see that term this week as well, are when people have both Medicare and Medicaid. These folks are often disabled individuals or people over 65 who have a lot of health issues and need input from both health insurances to get their health costs covered. The Social Security Act was the original law passed by Franklin Roosevelt in 1935. Medicare was not in the Social Security Act, but came out of the Social Security Act amendments in 1965. Medicaid, which is the state health insurance, also came out of those amendments. The Older Americans Act, which you will hear about later on in the semester, was also a 1965 law that pushed for a lot of services that support aging individuals in the community. This law created some home and community-based services like Meals on Wheels, allowed for in-home caretaking, some transportation services, elder abuse prevention services, created legal services for the elderly, and supported family caregivers. So you will hear about the Older Americans Act in 1965. That's a very similar law time period that created a lot of services for the aging community. CMS, the acronym, is the Center for Medicare and Medicaid. That's the federal office that oversees Medicare and Medicaid. Now, if you're saying, well, isn't Medicaid the state insurance? Yes, but the state is overseen by the federal government because the federal government gives states money to administer their Medicaid programs. CMS is the federal government program that oversees Medicare and Medicaid. Other programs you probably will hear about this semester are Social Security Administration, Administration for Community Living, Administration on Aging, the Administration on Developmental Disabilities. These are all other federal governmental administrations that are involved with aging health, Medicare, and Social Security. So this week, what I want you to do is think about some of the strengths and weaknesses of Medicare. Some of the major strengths of Medicare are obviously access. It creates access to health insurance for people over 65. Without Medicare, people over 65 would have to use their limited income to try to buy a private health insurance plan, which would probably be very difficult. Something else Medicare does really well is it controls costs. Medicare has so many people that they can tell providers, hospitals, doctors, other insurance companies, this is how much they're going to pay for something. And they can, because people want to be reimbursed by Medicare. Medicare also gets to do a lot of quality control. Medicare can say to states or to hospitals, if you want this money, if you want these federal dollars coming to you, you have to follow all these rules we're going to give you. So that creates a lot of quality. Think about the weaknesses of Medicare, though, as well. You'll see often that Medicare is expensive. Who pays for Medicare? We all do, and it costs a lot of money. Complexness. Medicare is often confusing to the consumers it's supposed to provide for. when you ask people if they understand their Medicare, they often don't. And that's because Medicare is not a simple insurance program. Medicare is also administered by the federal government, as we said, but there's a lot of private companies that are involved in Medicare. Like we talked about with the Advantage plans, you might have a private insurance company administer your plan. You might have private individuals doing your benefits or helping you understand something. So a weakness of Medicare might be that even though the federal government is creating a program that helps people get access to care, the federal government doesn't do all the pieces of that work. They actually farm out quite a bit of work to private entities. So I don't want to go on too long. You have a bunch of other videos. That's it for your first video. As always, I'm here for your questions, comments, or concerns, and I'll see you in the discussion forum. Thanks so much.